Hi, my name's Sherry. I'll be doing your exam today. How are you?
Good, how are you?
Can you confirm your name and date of birth?
Travis, March 18th, 1984.
Okay. Any recent complaints?
I just knee surgery recently.
Okay, so we'll take that into consideration when doing our exam. So just by appearance, patient's appearance appears well. He is groomed well. He's alert and oriented, able to tell me his name and date of birth. Skin tone is even throughout. I'm gonna just basically start at your scalp and we're gonna work our way down, okay? Face appears symmetrical, eyes, his ears, nose is midline, no deviations there. Okay, so feeling your scalp. There's no lumps or lesions in his scalp. Okay, just look at my face here. Okay, and then we're gonna kind of just work our way down to your sensation in your face and some muscle movement. So we'll test cranial nerves number 5 and 7. I'm gonna palpate your temporal muscle. If you can kind of clench your jaw. It feels firm and strong. The masseter muscle, firm and strong as well. I'm going to touch your face to test your facial sensation. If you can just tell me where you feel it, keep your eyes closed.
Forehead, chin, left cheek, right cheek.
Okay, cranial nerves number 5 and 7 are intact with movement and sensation. And we're going to look at his eyes. Eyes are symmetrical. We're going to do a couple tests with that. I'll have you cover one eye. We'll do the cover and uncover test. Okay, if you can cover your other eye. And when he does the cover and uncover test, his eyes do not try to move around the room, so that is a normal finding. Looking at his eyes, his conjunctiva are pink, sclera is white. There's no lesions, there's no discharge on the eyes, and again, they are symmetrical to his face. I'll have you just follow this pen light. I'm going to move it through the 6 cardinal fields of gaze. Okay, all right. Okay, and then I'm going to shine the pen light in your eye. Pupils are equal, reactive, round, and accommodate to the light. So that's testing cranial nerves number 3, 4, and 6 as extraocular eye movements. And now we'll do the Snellen chart. If you can read the lowest line that you can see with your corrective lenses on, I'll have you cover your left eye first. I'm just going to move back here.
Okay.
The lowest line you can see.
L, F, T, P, H.
Okay, and then if you cover your other eye.
L, T, F, P, H.
Okay, and then uncover both eyes.
L, T, F, P, H.
Okay, so client's vision, optic nerve number 2 is intact with his corrective lenses on. He's 20/20. I'm gonna just shine the light into your eyes so I can just check the inside of your eye now. If you want to just take your glasses off for a moment. Okay. Optic disc is round, red reflex is present, small capillaries noted with no bulging. Okay, and we have a red reflex on this side. Optic disc is round and the small capillaries are present. Thank you. You can put your glasses back on. Okay, all right. Fall asleep. Okay, all right, we're gonna move down to your nose. Looking at his nose, it's midline. I'm gonna just palpate any tenderness. Okay, and I'm gonna cover this side of your nose, breathe in, and then this side. Okay, his nose is patent, no issues there. I don't know any discharge coming from the nose. I'm gonna take a look inside. Turbinates are pink. Okay, both sides. Septum is midline, there's no deviation there. We'll test cranial nerve number 1. If you can just tell me the scent that you smell. What do you smell?
Lavender.
Okay, cranial nerve number 1 is intact. I'm going to feel your sinuses, frontal sinus, maxillary sinus, ethmoid sinus, sphenoid sinus. Any tenderness anywhere?
No.
Perfect. Okay. And then we're gonna go down to your mouth. Okay, looking at your mouth, it appears midline. No deviations there. I'm gonna test some more facial expressions and have you smile for me. Okay, puff your cheeks out, raise your eyebrows. Okay, and then puff your cheeks out again, and we'll press on each side. Okay, good. So cranial nerve number 7, again, that's more of the facial expression with the mouth involved, is intact. I'm gonna just look in your mouth. Okay, if you can say ah. All right, uvula moves up and down, taking the vagus nerve, cranial nerve number 10 being intact. Move your tongue from side to side. Okay, cranial nerve number 12 is intact. He's got 32 teeth in his mouth.
Sorry.
His tonsils are equal and round, no discharge, no odor coming from his mouth. Buccal mucosa is pink. Gums are pink and moist, no lesions on the tongue as well. We're gonna just check your gag reflex. Cranial nerve number 9. Okay, cranial nerve number 9 is intact. Okay, and then we're gonna move on to having you taste. So we'll add on to cranial nerve number 7. If you could just tell me what what you taste in that cup.
Water.
Okay, excellent. All right, cranial nerve number 7 fully intact with all the tests. And then we're gonna check his ears. Looking at his ears, they are midline. Any tenderness noted on the pinna?
No.
What about the tragus?
No.
Okay, I'm gonna have you cover this ear. I'm gonna do a whisper test on you. Cover your right ear.
Dog, cat.
Okay, and we'll do the same thing on the other side. Just repeat the words you hear.
Car, truck.
Okay, excellent. So you passed the whisper test, and then we'll do the Weber test. I'm gonna put this on top of your forehead, and if you can just tell me when you hear, where you hear the vibrations more, or if it's in the middle.
In the middle. Both
Okay,
ears.
all right. So that's a normal finding, him hearing out in both ears. And now we're gonna do the Rhine test. I'm gonna put it in the front of your ear and the back of your ear, and I'm just gonna time the distance of how long you're hearing in both
Okay.
sides. Tell me when you stop hearing it.
Here.
Okay,
That's it.
okay, so it's twice as long in the front as it was in the back, which is a normal finding. Air conduction is longer than bone conduction. Same thing on this side.
Okay. That's it.
Okay, and same thing.
Okay. That's it.
Okay, twice as long in the front as it was the back. Now we will just take a look into your ears. Okay, pearly gray tympanic membrane present, no cerumen noted. Pearly gray tympanic membrane present, no cerumen noted. Alright, and then we're going to move down to your neck. I'm going to feel your lymph nodes first. We've got the preauricular, postauricular, occipital, submandibular, submental, deep cervical chain, superficial cervical chain, supraclavicular. None of his lymph nodes are palpable, which is a normal finding. Looking at his neck, his trachea appears midline. There is no deviations noted. I'll have you turn this way. Okay, and this way. Okay, trachea is still midline even with client turning his neck. Palpating the thyroid. It's non-palpable. And then I'm going to listen to carotid pulses. Normal with no thrill. normal with no thrill, and we will listen for any bruit. Okay. No thrill. I'm going to listen to his thyroid. Okay. No audible sounds noted from the thyroid. Okay, so moving on from the neck, we will go on to your posterior chest. I'm going to have you turn this way so that your back is facing the camera. Got it?
Yeah.
Okay. Alright, so looking at his chest, it's flat. It doesn't seem like he has any labored breathing. Respiratory pattern seems normal. There's no difficulty noted there. Looking at his thoracic configuration, it appears symmetrical. I want you to take a nice deep breath for me. Okay, his thoracic expansion is also symmetrical and even. I'm going to have you say 9-9 as I move my hands down your back.
9-9.
A little louder.
9-9.
Okay.
9-9.
Okay.
9-9.
Okay, excellent. So no tactile fremitus noted. I'll now listen to his back, and we'll listen to the lungs. I'm going to start at the apexes of the lung. Nice deep breath. Got bronchial, bronchiovesicular, bronchiovesicular. Nice deep breath. Bronchiovesicular. Vesicular. Vesicular, good. Now we're going to move on to percussion. Okay, and we are going to start up here at the apexes. Okay, resonance heard in all lung fields. So we'll have you turn, face the camera. We'll do your anterior chest. Okay.
Yeah.
Okay, so looking at the anterior chest, again, it is flat. Breathing pattern appears even and symmetrical. We will start with listening and then we'll go into percussion. At the apexes, nice deep breath. Okay, bronchial. Bronchiovesicular. Bronchiovesicular. Vesicular. Vesicular. Okay, we're going to do some percussion. Arm a little bit. Okay, and we heard resonance over all lung fields. Okay, I'm now going to do his heart sounds. I'm just going to move myself over here. I'll just sit here for a moment so we can see. Okay,
Lay down, Sip.
yeah. I'll have you move back once we're ready. Okay. So on the right sternal border, second intercostal space, we have the aortic valve. S1 and S2 are noted. On the left sternal border, second intercostal space, the pulmonic valve. S1 and S2 noted. Third intercostal space, Erb's point. We've got the fourth intercostal space, the tricuspid valve. S1 and S2 noted. And the mitral valve at the fifth intercostal space, midclavicular line. S1 and S2 noted. And this is where I would listen to his apical pulse for a full minute. Okay, we've got 72 beats per minute. I'm going to have you just lean back slightly so I can assess for jugular vein distension, and turn to your left. Okay, and then turn to your right. No jugular vein distension is noted. Okay, we're going to move down to your abdomen now. You want to just lie back. Okay, we're going to listen to the right lower quadrant of his abdomen, right upper quadrant, left upper quadrant, left lower quadrant. Okay, bowel sounds heard throughout all of his abdomen, normal, active. Next, we're going to do some palpation, percussion. It's dull over his liver, and there is resonance in the rest of, or tympany in the rest of the abdomen. Now we're going to do some palpation, some light palpation. Any tenderness?
No.
Okay, no tenderness in any of the quadrants. Now we'll do deep palpation. Okay, and no liver was palpable in that right upper quadrant. No tenderness noted. Okay, and now we're going to move on to your upper extremities. Actually, wait, we'll do pulses with you lying. I'm sorry. So we already did carotid pulses. I'm going to feel his brachial pulses. Okay, they're normal with no thrill. We'll do his radial pulses on here. Normal with no thrill. His ulnar pulses. Normal with no thrill. You can bend up this leg a bit, the popliteal behind the knee. Normal with no thrill. We'll feel for your femoral pulses here in the groin. Kind of a deep palpation there. And they are normal with no thrill. And then we'll do the dorsalis pedis. Normal with no thrill. The posterior tibialis. Normal with no thrill. Okay. So now we'll have you sit up. We'll inspect your upper extremities. I guess you can stay this way, actually, it works better. Like this. Alright, so looking at his upper extremities, I will feel for his scapula. There's no deformities, no masses. His clavicle, no deformities or masses. Okay, I'm going to feel down his spine, which appears midline. Okay, no masses or deformities. Shoulders, no masses or deformities. The elbows, no masses or deformities. Wrists, no masses or deformities. Okay, we're going to go through some range of motion. If you can put your arms straight up and then put them behind you like this. Okay, range of motion of the shoulders look good. I'll have you lift your arms up straight up against my arms. Good. And down. Good. Strength is good. We'll have you hold your arms straight out. Bring back to you for flexion. Okay, down for extension. Good. And then we'll have you go back against my arms, test your strength, good, and down, good. Okay, keep your arms out. We'll have you do your wrists backwards, frontwards, and then we'll have you do internal rotation and external rotation, okay? And then we're gonna have you open up your fingers like this, okay? And if you can close your hands like that, excellent. And then just rotate your wrist in and rotate your wrist out. Okay, and I'll have you squeeze both of my hands to test for strength. Good. So strength of his upper extremities is all in normal range. We'll now go down to the lower extremities with the exception of the left leg because of his surgery site there. So I'm gonna have you lay back again for your hips for a moment while you're in this position. I think that'll be easier for your hip flexion. If you can pull your legs back towards you, okay, and down. His hip flexion and extension on the right is normal. We've got limited movement on that right side. And then we'll have you sit up. We'll do, actually, I'm sorry. We'll lift your leg up to test your hip strength, up, and then down on my hand. Good, okay. Now you can sit up. We'll test your knees. Swing it over this way. Okay, so looking at the rest of his lower extremities, his hips, I do not feel any deformities or masses. The knee, obviously this one is covered. The right one feels normal, no deformities or masses. Ankles, there are no deformities or masses. Okay, so for the knee, I will have you kind of kick your leg straight out, bring it back. Okay, and then I'm going to have you push against my arm out and push against it back. Okay, and then we'll test your ankles up and down. Okay, good. So the strength in his knee and his ankles are good. Now I'm going to go into reflexes throughout. We'll start with the upper and move down since he's in a sitting position. We're going to test the biceps reflex first. If you want to just rest your arm on your hand. Okay. Okay, and we elicited a response with that biceps reflex. Now we'll check the triceps reflex. Okay, we've elicited a response there. And then we'll do the brachioradialis. And kind of rest your arm in that position. Okay, and we've elicited a response there. And we're going to do the same thing on the other side. So we'll go biceps reflex. Okay, and I've elicited a response. Triceps. Okay, and we've elicited a response. And then we're going to do the brachioradialis. It's okay. Okay. Okay, and we've elicited a response. I'm going to move on down to the lower extremity reflexes. Aside from that left knee, we will do the patellar reflex on the right side. Okay, all right. Okay, and we've elicited a response there. And then we're going to do the Achilles. I'm going to hold his leg up for this. I gotta be able to see it here. Okay. I'll hold his leg up to see if we get a response from the Achilles. Okay, and we've got a response from the Achilles. And then we will do the plantar reflex. Okay, and we've elicited a response there as well. I'm not going to do that left side because the jerking movements is going to hurt his knee there. Okay, so moving on from all of that, we're going to go through some neurological tests now. Trying to figure out the best place for me to stand. Okay, so sitting down, we'll have you do some rapid alternate movement. I'm going to have you start with your hands on your lap there. Okay, and I want you to do this really fast on your hand. Okay, all right, rapid alternate movement is normal. We're going to do some exteroceptive sensation, and we're going to have him identify temperature and whether something is sharp or if it's soft. So if you can close your eyes, tell me what temperature you feel this is.
Cold.
Okay, good. And then I'm going to touch you with something and just tell me if it's sharp or soft.
Soft.
Okay, good. Those are normal responses. Now we'll go to proprioception, and we'll go through motion, vibration, and some sensory or position movements. So with motion, I'll have you close your eyes and touch your finger to your nose. Excellent. Okay. And now with the vibratory, I'm going to hit the tuning fork. I'm going to place it at the end of your distal finger here, and if you can just tell me when you feel it stopping vibration. Okay.
Stop.
Okay, we'll do it on the other side.
Stop.
Okay, good. And as far as position, I can't really have him do heel to toe, so I'm going to have him grab an object for me. Where did my little ball go? Okay, I'll just have you grab for this. Okay, and then I'm going to have you with your other hand grab for this. So his position is normal. He's able to reach forward and grasp an object. Next, we're going to do the heel to shin. If you can take that heel and just rub it up to your shin there, all the way up his shin. Okay, and he did that well with that right leg. We're not going to be able to do it on that left side. And then we're going to do stereognosis, where you identify an object in your hand. Okay, you close your eyes. I'm going to place something in your hand. Tell me what it is.
Pen.
Okay, and then in this hand.
Paperclip.
Okay, excellent. So those are normal findings. And then next we'll do what we call graphesthesia. I'm going to write in your hand and just tell me what letters you feel.
B. O. O.
Perfect. Okay. And now we're going to do the 2-point discrimination. I'm going to touch you with these tweezers, either one side or two side, and you just tell me what you feel.
1. 2.
Okay.
1. 1.
Okay, excellent. And then after that, we're going to do extinction standing. So I'm going to touch the sides of your body. You tell me where you feel me touching you. Close your eyes for me.
Left shoulder. Right shoulder. Left shoulder. Both.
Okay, excellent. And now we'll go to standing. I'm going to have you stand up. Okay. So standing, he has good balance even with his leg injury, so that is good. And then we'll have you, we can't have him really walk on his heels because he kind of needs crutches, so we're going to unfortunately have to say we are unable to do that. And then walking on his tippy toes, I don't know if you can go on your tippy toes at all, slightly, okay. Normal finding considering the injury. And then we're going to do the Romberg sign. I'm going to have you just hold both arms, hold both arms at your side. Close your eyes. Okay, and again, he has pretty good balance, a slight sway, which is a normal finding in a negative Romberg sign. And then we'll have you do the pronator drift, where you hold your hands out in front of you with your palms facing up. And I want to just see if your palms sway at all. And they do not, so that is good. That's a normal finding. Okay, you can have a seat. With the cranial nerves, I didn't mention, but we did all the hearing tests. So cranial nerve number 8, he is intact for him. All of his hearing tests were passed. We did cranial nerves number 9, 10, and 11 with the, 9, 10, and 12 with the tongue movement and the tongue, the taste in his mouth. The only one we kind of didn't get to incorporate in that is cranial nerve number 11, the accessory. So I'll just have you shrug your shoulders up and down. Okay, and then against my hands. Okay, and cranial nerve number 11 is also intact. That concludes our exam for today. Thank you for your time.
Thank you.